Welcome, everyone. Thanks for being here today. We are thrilled to have so many wonderful people joining us for this event. My name is Meghna, and I am the Colorado State Captain at Right to Health Action. Just give me one moment here. Okay. We have a few people joining. Okay. All right, so let's get started. Right to Health Action came together during the first days of lockdown as a group of people united in anger. We were facing another pandemic that should have never happened. It was being made worse by the reprehensible, hateful policy decisions of the former White House occupant. And since then, we have grown into a 50-state grassroots movement of frontline health workers, people who have lost loved ones, COVID survivors, and emerging leaders, students and youth leaders who believe health is a human right worth fighting for. We are 2.25 years old this month. So basically, here's the thing. So after 2 years, we continue to see casualties mount, and we continue to see some of our leaders make things worse with bad policy decisions. We still see Republicans killing historic bills over petty disputes, bills that would vaccinate the world and pandemic-proof the planet. We see urgently needed life and death funding for COVID care and relief held hostage by Republicans who want to take authority away from the CDC and permanently impose Donald Trump's heartbreakingly racist policies that turn away legal asylum seekers at the border. So we have a message. You don't need a weatherman to know that there's a storm ahead. COVID is not over, and there are millions of us who cannot and will not move on until we have put policies in place that we need to prevent future pandemics. We cannot go back to normal if the new normal means leaving millions behind. So the midterms are coming up. We need all hands on deck for a short-term project to be an emotional and powerful presence on the campaign trail. When candidates hold an in-person or virtual event, we're going to be there, sharing our personal stories, winning over their supporters, and putting them on the spot with demands that they cannot refuse. During this pivotal moment, it's more important than ever to center and lift up the stories of people from the front lines who are fighting for the People's Pandemic Prevention Plan, in spite of and because of the physical and emotional damage of COVID-19. So to get things started, I would like to introduce Karen Bishop. Karen is the founder and president of the COVID-19 Long Hauler Advocacy Project. She has a Bachelor's of Science in Exercise Science and Health Promotion, and was a firefighter and paramedic when infected with COVID-19 in March of 2020. She sits on the advisory board of the Long COVID Research Fund, serves on the Ancillary Studies Oversight Committee for the NIH's Recover Initiative, a nationwide study into long COVID, and is a single mom trying to navigate being newly disabled. Thank you for being here with us today to share your story, Karen.
Thank you so much for having me. Hello, everybody. My name is Karen Bischoff, and I am the founder of the COVID-19 Long Hauler Advocacy Project, a nonprofit whose mission is to advance the understanding of long COVID and expedite solutions and assistance for long haulers through advocacy, education, research, and support. I am what we in the long COVID community call a first waiver, someone who got COVID at the very beginning of the pandemic. I have been sick since March 2020 after becoming infected while working as a firefighter paramedic here in South Florida. Unfortunately, millions in the US, just like me, have been sick for over 2 years and remain without resources. For many long haulers, this reality, the lack of resources available to them and their families, is a shocking wake-up call for the same system so many in the disability and chronic illness communities have been aware of and fighting to improve and trying to raise awareness about for decades. It is now in this time, as the rest of the country begins to move back into their normal, forgetting all about the millions who died and the approximately 40 million now suffering long COVID, that we need to make a commitment to one another to not give up and not let history repeat itself, leaving all of us forgotten and in the past. In a tumultuous time of change and upheaval, it is our time to rise and ensure equitable access to medical care and social supports, are a basic right for everyone. If we cannot accomplish this after the impacts of the COVID-19 pandemic, we likely never will. This is a call to action for all hands on deck to ensure that this does not happen again. For the last 26 months, I have been unable to work. I have had to manage not only my new physical health issues, but all of the socioeconomic aspects that come along with it, not to mention everything that comes along with caring for a child as a single parent. The all-out effort of finding and identifying competent healthcare providers have been like a full-time job in addition to trying to navigate the numerous benefits programs I so desperately need. I have gone through unemployment, workers' compensation, Medicaid, food assistance, temporary cash assistance for a whopping $158 a month for a family of 2 to live off of. I applied for Social Security disability only to get denied twice, and I am now awaiting a hearing. Long COVID is really this unforgiving collection of post-viral illnesses, all of which we knew about before, but for some reason ignored during the pandemic, with one of the worst viruses to date. Over 200 symptoms have been documented in long COVID, many of which are part of the 3 most prevalent conditions in long COVID: dysautonomia, ME/CFS, and mast cell activation syndrome. Many are also developing fibromyalgia and other chronic pain conditions, autoimmune diseases, chronic migraines and headaches, as well as motility and inflammatory disorders of the GI tract. All of the conditions mentioned I have developed. At 27 months post-infection, I still suffer with nearly 90 symptoms. I've seen about 40 doctors, and at this point, I am at a standstill with treatment because there is nothing left to try at this time. Having one of these conditions alone is bad enough, but to have a collection of multiple disabling conditions makes ADLs nearly impossible. As the world seemingly embraces its endemic stage, as we continue to tally deaths and disability in the thousands daily, ignoring the impacts to the economy and near certain collapse of our medical systems, we will fade into the background. We must collectively recall history and rapidly take action to prevent the millions of newly disabled long haulers from being forgotten and losing the monumental opportunity long COVID has presented for all of the chronic illness and disability communities. We must welcome allyship and work to consistently collaborate with one another, government officials, and health agencies to move the needle forward. I truly believe one of the most beneficial things for the long COVID community was the early education provided to long haulers by other chronic illness communities and disability organizations. I'm a firm believer in cross-community education and believe it is one of the best ways we can build a consistent and solid foundation for our collective needs and desired outcomes. We must build a system that does not force us into poverty or progressively worsening health due to its inaccessibility and complexity. We can and will prevail if we choose to do so. If not, there will be no return to normal for millions of Americans, and that should never be ignored, forgotten, nor accepted. Thank you.
Thank you so much, Karen. I'm sorry that you've had to endure all of that. Your experiences and those of countless others worldwide really drive home the importance of fighting for transformative changes that we need to repair the damage and make sure that this never happens again. We cannot allow a new normal that just accepts that new pandemics will come. Poor people will just die, and the immunocompromised, elderly, and people with disabilities are left behind. We are fighting to vaccinate the world, even while racist mainstream media reports that poor people no longer want vaccines. Last month, we saw an enormous victory where the US National Institutes of Health committed to donate free of charge many of the most important publicly financed inventions to the medicines patent pool, making many of the key inventions for mRNA vaccines open source and public domain. This was a huge victory. Likewise, even when Congress melts down, we are still winning a new global fund to fight pandemics. Slated to be formally launched this November by the G20, R2H Action's People Power has won a seat at the table, and we are demanding the policies we need to prevent this nightmare from ever happening again. Today, we will learn more from experts about how the new normal is unacceptable. We will then stick around for an open discussion where we can talk about what you can do about it. So this includes a term called bird dogging. So this is teams of people who show up IRL or at virtual campaign events and share your stories, make demands, put policymakers on the spot in public and on camera where they have to answer. Before I introduce our panel here, I just want to let you know that following the panel and audience questions, you are invited to participate in a collective discussion to debrief, connect with other like-minded advocates, and learn how to plug in. I want to take this opportunity to thank our panelists again, as well as the R2H team members who have joined us for multiple meetings to make this event happen. Couple quick notes on technology. All attendees will be muted during the panel discussion. If you have to leave the meeting at any point or get kicked out and want to rejoin, simply use the same link that you originally joined with. You can also submit questions via the chat at any time. We will refer to these questions during our Q&A time following the panel discussion. And we are also recording the panel portion of this webinar to be shared within the coming week. With that, I am thrilled to introduce our speakers for this evening. First, we have Erica McKibben. Erica is a community advocate from Georgia with over a decade of experience working with survivors of domestic violence and sexual assault, both as a civilian and as a military contractor. After graduating from high school, she served in the US Navy and US Army and is a proud disabled veteran. The death of her father from COVID-19 on April 7th, 2020 led her to become an activist with Right to Health Action, fighting against future pandemics. We also have Greg Gonsalves, an expert in policy modeling of infectious disease and substance use, as well as an expert in the intersection of public policy and health equity. For more than 30 years, he has worked on HIV, AIDS, and other global health issues within several organizations, including the AIDS Coalition to Unleash Power, the Treatment Action Group, Gay Men's Health Crisis, and the AIDS and Rights Alliance for Southern Africa. And then we also have Mia Ives-Rubley. She is a policy director of the Disability Justice Initiative at the Center for American Progress. She also serves as a commissioner on the President's President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. Ives-Rubley obtained her master's in social work at UNC Chapel Hill and began working with disabled people to help them find work and independence in their communities at the North Carolina Division of Vocational Rehabilitation Services. My apologies. But welcome to our panelists. Do we have any questions before we get started? Okay, I'll go ahead and ask the first question for the panelist group. All right, so increasingly our government seems to be moving on from the pandemic. Who are we leaving behind by taking this approach? And I'll open the floor to all of our panelists.
I'll go first. I did not coordinate with Greg, so just FYI. I'm big into flannel, but I guess Greg is too. Super glad to be here tonight to chat with you all about the issues around COVID and disability. I want you to think about all of the people that you know in your life, and then think about how many individuals have disabilities. If you think about them, think about 1 in 4 of each and every one of your friends and family members are going to have some type of disability. So when we talk about who's impacted by COVID, of course, everybody is going to be significantly impacted by COVID, whether you have a disability or not. But when you add disability to sort of the conversation, we're going to be looking at higher proportions of how it affects you in your everyday life, from everything from being able to go to the grocery store or being able to hang out with your friends. And, lastly, being able to go to the hospital, right? As COVID cases continue to rise or have a spike, it means that individuals with disabilities and chronic illnesses aren't going to be able to go and get their normal doctor's appointment. And so a lot of individuals have been having to delay their appointments. And one of the things that we've noticed is that as we get farther and farther along in this pandemic, we're seeing an increase in disability. The Center for American Progress found out that while reviewing the Bureau of Labor Statistics, found that 1.2 million more individuals have disabilities. And that means, significant disabilities. That doesn't count individuals who might have gotten diabetes or some other disabling condition. We're talking about individuals who are going to face significant difficulties getting jobs. And so when we're talking about 20 to 30 million individuals who have long COVID, we're talking about many of those individuals who are going to have long COVID that is significantly disabling, which means that while we're looking forward into the future, that those individuals are going to be significantly impacted by COVID in the future, because they're going to have lower immune systems, right? They're going to be delaying their medical treatments, et cetera. So that's a lot of individuals that are impacted by COVID.
I'll just piggyback off of what Mia said. Basically, she's right. I mean, here in Georgia, I feel like we never really shut down, unfortunately. And I feel that we are going to leave behind a lot of people. I mean, my concern is with a lot of the testing cutbacks that people are not going to have the numbers actually reported, how many cases are really out there. I know for me in my job, I am right now really almost the only person wearing a mask at work because I'm trying to protect myself. I do have some underlying conditions, but we're going to leave behind the people who have disabilities, who may not even be able to get vaccinated due to whatever their, they may have makeup, but they can't get it right now. Young people who are 5 and under who can't get vaccinated. And then you have the marginalized communities, people who don't have insurance. So it's just, you're leaving. I think what upsets me, even after losing my dad, is I hear people say, we're going to everything's back normal and you don't have to worry about everything. Everything is not normal, and it upsets me. We're leaving behind so many people. And as Americans, I always thought we were supposed to care for each other and uplift everybody. But if we're leaving communities behind of people who mean something, people who don't have to die, they're still dying, how can we, what are we actually standing for? We're leaving our fallen people behind. I was in the military. I always believe in teamwork. You never leave a fallen man behind. And I feel like us doing that by saying everything's normal, going back, throw the mask off, we're basically leaving behind so many people in society that should not be left behind. Whether they can't afford it. I mean, I know in Georgia, they do have some long COVID clinics, but how many people have insurance? How many people have transportation to get through those appointments? So I think as us, the only thing we're going to do to make it better, we have to put leaders, I know it's hard to say, in positions to make that difference. People who understand, people who may be disabled themselves. But if we don't do that, we are having people die who do not need to die for no reason. So that's the thing I want people to think. Like Mia said, how many people, think about people, your neighbors, think about your loved ones, think about your family members who are disabled and cannot get out and do things, who are having to suffer. And not only physically, mentally, that's a big thing too. It's a mental toll on a lot of people. So I'm sorry, I didn't mean to ramble on.
So I'll just add to what Erica and Mia said. So one is, the idea that we're leaving people behind means that somebody's going somewhere that's different than we are, right? The point is like we're all stuck in the middle of the pandemic. It's not endemic. The latest news is that we have 2 new variants, BA4 and BA5, which are going to prolong the current wave, right? And so while people who are immunocompromised or disabled are going to be at severe risk of disease. You know, I was on the phone today with a friend who's been sick for 23 days and had a positive rapid test for 23 days, who was vaxxed and doubly boosted, right? And so COVID is not going away, even if people want to pretend it is. You know, the only other thing a couple of things I wanted to say is that, you know, our healthcare system can't take this, right? You know, we're having 300 deaths per day, right? We're having lots of hospitalizations per day. That means we're having like close to 10,000 deaths per month, right? We have enormous strain on hospitals, and if we're not full up to the gills in our hospitals, we're having people coming, physicians and nurses and everybody else going out sick, so that the basic medical care that many of us are incredibly vulnerable and have other conditions to deal with can't go to the hospital to get what we need, or can't go to the clinic, or can't go to the doctor to get what we need done. The other thing is that we have a lot of power, right? And I know we'll talk about this a little bit later, but so much of this is playing out at the local level. You know, you can go to your school board meeting, you can go to your city council meeting, right? You can march into your hospital CEO's office wearing your mask and say, why aren't your frontline physicians wearing masks? None of this, you know, yes, we have to deal with Congress and the appropriations process and all that, but so much of this activity can happen right in your own backyard, in your own town. And I think, you know, that's where the rubber meets the road. I just read that Boston's going to lift its mask mandate in schools. And they're talking about how they're going to organize in, you know, one of the most liberal cities in the country. But all of this is incredibly local, and we have enormous power together with this group of people in Right to Health Action, coast to coast. So I think there's a lot of work to do, and it starts right where you live.
Thank you all for sharing. I think you all raised some great points, that this affects so many more people than we even can imagine. Affects the elderly, immunocompromised, young people under 5 who are immunocompromised. And thank you, Greg, for stressing the point that we can take action at the local level, and we need to call on our Congress people to do something, to do more, to do the right thing, and try and prevent future pandemics. I'll go ahead and ask the second question. Unless there's anything you all want to add. Our next question is, how do, oh, my apologies. I'm so sorry. I think I am glitching over here. Is there another R2H member who can see the questions? My apologies. Okay, what are the implications of pretending that the pandemic is over? What can we expect to see down the road when it comes to disability rates, endemicity, et cetera? Does anyone want to go ahead and try and answer?
I'm sorry, can you repeat that question again?
Yeah, I apologize. Let me just see here. Just give me one moment. My my internet is lagging over here, so I'm so sorry.
You want a hand, Magna?
Yes, please.
Yeah, panelists, let me jump in here. So what are the implications of pretending that the pandemic is over? What can we expect to see down the road when it comes to disability rates, endemicity, et cetera? So what are the long-term consequences that we're missing and that society is neglecting, and, you know, that is in our rear view that we can't see? Thank you.
Greg, do you want to go first? I see you're unmuted, or I can go.
So one is, we are not in an endemic phase of the pandemic, right? Endemic means we sort of at a steady state, and like we don't have like waves of virus coming at us. And as I just said, you know, we've just dealt with like the son of Omicron, you know, in the late spring, and now the summer is going to be BA2, BA4, and BA5. And it's going to extend this current wave into June and July. You know, the point is that for all the people who think the pandemic is behind us, and, you know, that they're vaxxed and done have a big surprise coming, because we have not conquered this pandemic yet. And remember, 30% of Americans are boosted, right? So there's a huge number of people who may not have underlying conditions, may not be immunocompromised, who are incredibly vulnerable to new variants. And BA4 and BA5 actually are pretty good at evading the immune system to begin with. And so we basically unilaterally disarmed. It's like mission accomplished for COVID-19. We saw some of the worst and deadliest months of the pandemic this winter with Omicron. We may have some respite because we can be outside and avoid some of the close contact we can't do it in the winter months. But we are heading towards a devastating fall and winter, mostly because all the money runs out, right? All the money for vaccines, treatments, diagnostics runs out for the uninsured. In the ability to buy new vaccine doses runs out. Any of the sort of social and economic supports that we depended on in the first and second years of the pandemic are gone. And so the winter of 2022-23 could be a pretty gruesome one moving forward, even in the context of a country that has maybe 60 to 70% vaccinated.
100%. One of the things that I thought was very interesting, because we know politicians always think about money and impacts on money and economy. And one of the numbers that I found really, really interesting was from the Solve Long COVID initiative. And they estimated that it was $386 billion of financial burden on the economy from 2020 to 2022 due to long COVID effects on employment, savings, and medical expenses. That is a huge number. I can't even wrap my head around that type of number. I think it's really important as politicians, CDC keep on saying, well, let's look at the hospitalization and the death rates, right? As the sort of way to decide how we're doing against COVID. And even a recent article that came out saying that the White House was talking about what would be the exact number of deaths that we could say, well, we're through with this pandemic, we're through with COVID, and we have finally, conquered it. And the thing that it does not take into account is the long COVID effects. And I sit there every single day talking with folks on the Hill, with folks at the White House, with folks at CDC, at HHS, always talking about the impacts of long COVID. And, I think it's really important to understand that we are seeing huge numbers of individuals who are going to be dropping out of the employment pool. There are individuals who are running out of short-term and long-term disability. There are individuals who are going to be sitting in the pipeline trying to get SSI and SSDI. There are individuals who are going to be trying to get on safety net programs. And we are about to run into a huge train wreck. Much like what Greg was talking about, is I could see probably this fall, with the likelihood of COVID going back up again, even though we're still in sort of a spike. There's already predictions that this fall is going to be absolutely horrendous. We're going to see that at the same time that so many of these individuals are going to run out of short-term and long-term disability. And so I think that it's incumbent upon all of us as individuals that live in communities to call legislators out, both on the local level and on the national level, to ensure that they understand these impacts and don't allow it to go silently. I think as you know, Greg's introduction was talking about the AIDS epidemic, right? The thing that we talk about in terms of long COVID is that COVID is such a mass disabling event that it is comparable to the AIDS epidemic. It's comparable to the polio epidemic. And we are not taking it seriously. And one of the things that we need to do is, you know, we saw the Ryan White Act, which didn't solve everything, of course, but was at least some significant legislation that addressed some of these issues. And we're just not seeing that type of interest at all at the congressional level.
Great points, Mia. I think we've all seen that this is so much more than just you know, number of lives lost. Of course, it is about the lives lost, but it's also about the long-term implications, the quality of life, the disabilities that comes from long COVID, the mental health toll. There are so many factors that need to be addressed. And let's move on to the next question here. Recognizing that we are no longer in the initial stages of the pandemic and mitigation measures like mask mandates that worked in the past have less public support now, what do our institutions need to be doing differently to minimize the ongoing damage that COVID is causing?
Erica, do you want to go or I can go?
I can go. I'm sorry, my screen froze there for a minute, so I don't know if I was frozen. I definitely, to me, honestly, it's all about stop lying and understand the truth. That's one thing. I mean, I worked in domestic violence, so I don't know about gaslighting. I mean, like, we were basically lied to. I mean, I'm angry about it because not only did I lose my dad early on, I feel a lot of people lost their lives who didn't have to die because of the lies. A lot of people are sick now with long-term effects that they didn't have to get because they were told one thing. So it's really about the truth. Just stop lying to us. Understand the truth. Understand science does work. Yes, we understand you're vaccinated, you're boosted. That doesn't mean that it's okay to go out there and I'm never going to get, that's not going to happen. It all is about education and not lying. And that's the problem that upsets me, is that we were lied to so much that people are believing these lies. And it's almost like they're pretty much brainwashed. It's like we got to bring them back, because if we don't, like you said, it's going to get worse. I mean, the summer, I mean, oh my God, I live in Georgia. I could not believe how many people were traveling here, like sports arenas. It's all about money to me. It's all about the summers here. Let's make money. Let's forget about who's actually being affected by this, because most of those people who work in those sports arenas are people who are front. A lot of them are people of color. A lot of them do not have insurance, so they are going to get sick. Therefore, they can't go to work. Guess what? That's going to affect everything else. That's why it's such a shortage. So it's all about the truth. Just tell the freaking truth. That's all I ask. Without that, we don't have anything. We won't get out of this mess. Just stop lying. We're not stupid. I believe we're very smart. I want to believe in this country. I want to believe in the people, but just stop lying to us. You know, I go back to, I think Greg or somebody said mission accomplished back when I was younger, George Bush. Oh, mission accomplished? No, it was not accomplished. And as Americans, we're very shiny. I see all that. Well, you know what? We got to get out of that, because I do remember that. It's like mission was never accomplished, but it looked good. It sounded good. And my worry is the long-term effects. You know, my grandbaby actually got COVID, not even a year old. I worried, what is that going to do to him long down the road? We don't know. We're still learning, but why put ourselves through that when we don't have to go through that? So that's where I'm at.
I mean, I'll build on what Erica said. You know, we're being sold a pack of lies. And it's one thing to be lied to and misled by the Trump administration. But we have people who consider themselves liberals, like people like Lena Wen, who was the former health commissioner of Baltimore, David Lenhart, who writes the morning newsletter for the New York Times, Lucy McBride, who's a famous CNN talking head, concierge internist in DC, Ashish Jha, who used to be the dean of the Brown School of Public Health, but who's now the COVID czar in the White House, Joe Allen, who's a Harvard professor, saying, you know, take off the masks, go back to normal. We got to learn to live with the virus. 10,000 people will be dead in the month of June the way we're going, right? And so I don't want to be rude, but I'll be rude. The point is that they have the privileges to protect themselves. They'll get Paxlovid, they'll get the monoclonal antibody treatment, they'll have access to N95s, they'll have access to rapid tests, they'll be able to stay home if somebody in their family gets sick. They have everything they need to reduce the impact of this virus on themselves and their families and their loved ones. They're not going to escape it, but they are making policy from a position of privilege. And we've got to call it out, right? We have to call it out. The point is that, you know, certain school districts, you know, say we don't want masks. There are other school districts who desperately want it because they don't have the luxury of making a contract with the MIT Broad Institute to do testing for their students, staff, and teachers, or to put new HEPA filters in, or to make sure that, you know, everybody's vaccinated. They're dealing with crumbling school infrastructures for 40 years. And masks are the last refuge between them and the virus. Right? San Francisco wants to put a mask mandate back in place. I'm sure Lena Wen's going to be on CNN tomorrow telling us how bad it was. Right? So there's a bunch of people who are middle class people, privileged people, who are really trying to sell us a bill of goods that's really about the president's political survival in the midterms, because he thinks if we talk about COVID, it's box office poison, nobody wants to hear it anymore. The point is, leadership is about saying the tough things, not just saying what people want to hear. And for some reason, Ron Klain and the rest of them in the White House have told him, you know, turn the corner on HIV, on COVID, stop talking about the virus, stop talking about all these things we need to do. And then they're trying to beg for money from Congress. So you can't have it both ways. The pandemic is either over or it's a crisis and you need more money from Congress. As Erica said, they got to stop lying to us and be honest with the American people and give us a little bit of tough love. It's not going to be over until we've, you know, fight our way through this pandemic. And we're tired and we're fed up and we're angry and we're frustrated, but wishing doesn't make it so, right? It's not going to go away just because we want it to be 2019 again.
Man, yeah. Greg, your and I's continual fight with Dr. Lena Wen is something to behold. Yeah, I think that 100% agree with both the panelists on just the need to face the truth, the stopping of the gaslighting on the situation. I can't tell you how many times I go into a meeting with somebody at the White House who decides that they think that I don't know anything about COVID or long COVID, and they want to sit there and try and explain to me what long COVID is every single time that I meet with them. And I think they expect us to not know what we're talking about. They expect us to sort of go along with the program. And I think it is going to be upon us to continue to push our local representatives, pushing our state representatives, pushing all of these individuals who are making policy decisions, and call them out on the problems that are going on. I think the bird dogging is extremely important. I think that doing your research is going to be very important. There's a lot of people who say that they're public health experts who don't know a thing about public health, or are willing to be paid under the table to spout whatever the corporation that wants them to spout. So I think it's really important to do your research, understand the issues, and really work towards creating systems of aid within your own communities, because unfortunately what we've seen right now is that the folks in power don't want to do anything because they're worried about their elections. So I think, we saw, particularly during the beginning of the pandemic, tons and tons of mutual aid programs that were being built up. And I think it's really important for us to continue those programs, continue to build up. I think it's also really important when you see something happening that you don't think is right, to report it to your representatives, report it to journalists. One of the biggest ways that we've actually been able to get change to actually happen, even if it's the smallest amount of change, is talking to journalists. We have ruffled quite a few feathers in that process, and making sure that folks understand what is going on in the back rooms, who's making decisions, why they're making certain decisions. Demand that you get a meeting with specific people. It's the only way that we have been able to gain any traction or progress, is to continue to beat the drums and yell out the issues that we're facing within our own communities.
That's great. There's a lot to be learned from all of the work that you're doing. I think it is incredibly important to speak the truth. So, I urge all of you on this call to reach out to your members of Congress, reach out to local media, just spread the truth. The misinformation is widespread. So we want to be spreading the truth, the scientific evidence. And just in the interest of time here, I'm going to move on to the next question, and I'm going to post it in the chat as well. So Todd Woodward from Oregon states, those of us who are older remember the HIV epidemic. The parallels and similarities between HIV and SARS-2 with regards to immune system damage and delayed long-term issues and society and government systems putting the burden of the diseases on marginalized and vulnerable communities is striking. He also asks, what lessons from the HIV fight can we apply to SARS-2? Greg, would you be willing to give your comments on this important question? We can move on to part 2 of the question after you respond to the first section here. So I'll open the floor, and Greg, you can go ahead.
One is the fight against HIV is not over, right? There's plenty of people around the world who don't have access to antiretroviral drugs. We're expecting a rush of new infections in the United States because so many people have not been tested over the past 2 years during the pandemic. We also know that 15% or more of people around the country don't even know they're HIV positive. So the HIV epidemic is 40 years old. And we still have a fight to make. And so part of this is realizing we're in it for the long haul. We're in it till we win it, right? And I think we're gonna have to figure out how to sort of sustain ourselves through this, because COVID may be a shorter term pandemic. Maybe it will attenuate over the next 4 or 5 years, but we can't count on it. And so we have to figure out a way to sort of deal with the short term, right? Deal with the sort of fact about federal funding, what's happening in our state and local levels. But with HIV, we have to think about the long game. How are we going to take care of everybody with long COVID in the years ahead? This enormous amount of sort of disability services and long-term healthcare needs and long-term care needs, we're going to have to think about. How are we going to build these infrastructures of care, right? For the long term, for people living with long COVID, right? And people who are getting acute primary disease, 3-4 years from now, when nobody wants to even talk about this at all. And so we have to think about not just the short term, but think about what our long-term arc is, about what we're going to be doing 5 years from now. And it's very hard to sort of sit back and say, okay, what are we going to do? But I think one of the lessons for me from the AIDS epidemic is that we're busy putting out fires all the time, that we didn't have time to sit down and think about what was going to be good in the long term. And so, we did the sort of expedient sort of political moves in terms of dealing with an appropriations bill this year or that year, but left too many people behind even 40 years into the pandemic.
Yeah, I think one of the things that we really need to remember is that disability has been with us. It's nothing new. Getting ill is nothing new. That the disability community has been fighting for all of the new individuals who are coming in with disabilities, from the AIDS pandemic to polio to now COVID. This isn't new. The fact that we have not centered disability in the work that we do all over the country and all over the world is the reason why we are in the situation that we're in right now. Because we see certain individuals as expendable, particularly individuals who are multi-marginalized. So when I think about like what's next, what do we need to do? We need to center the most marginalized in our community in thinking about the policies that we're putting in. That includes looking at the services and safety net programs, looking at things like universal health care. One of the reasons why we're in this situation is because we have a really shitty healthcare system. I'm sorry for my language, but we look at all of these things that we knew were problematic, and putting stress on it like a pandemic has shown how weak our infrastructure is. And I think it's really, really important that we spend the time rebuilding these structures, reworking them, creating new structures that will help focus on the most marginalized. Because if we focus on those individuals, we're going to help everybody. And I think a lot of people don't understand how that works. But if we're talking about looking at people who are falling through the cracks, and we create an infrastructure and a safety net to help those individuals who are falling through, we're going to lift everybody up. And we're going to ensure that we don't have so many people who are in the service industry who are working, toiling hours and hours, or people who are farm workers who are dying because, there's massive sweeps of spikes of COVID going on in their work field. If we pay attention to these individuals, we're going to do much better as a whole, as a society.
I just want to piggyback real quick. I'm sorry, Megan, on what Mia and what Greg said, is that we have to stop like a blind eye. I think sometimes people focus on what's ahead. They don't look at the people below us. And I was looking in the chat, and you're right. Homelessness is really bad. So we're not thinking about people who are homeless, who don't even have, they never had health care, who's got COVID going around, and people in jails. That's something that I think a lot of us, we know it's there, and some of us want to ignore that problem. But like Mia said, we're all inclusive. Everybody has a connection in the world. So we can't just throw those people to the side like, well, that's their problem, we don't have to worry about them, because we're all affected in some kind of way. And if you got to look at it, you got people who are working homeless, who are homeless and actually working. Well, think about that. I mean, just from today, I'm not disclosing anything, but I met a lady who is on a walker. She had COVID 3 weeks ago, can't breathe. Her son, she gave it to him. She got it from work. Well, they got evicted today, and they were looking for shelter. So you got to think about those things. Here you got 2 people who are displaced, who had COVID, and she's on a walker. So think about those are people who really didn't have insurance in the first place. Now they're evicted. So just think about how that affects us as a whole. But we have to stop having a blind eye, like, well, that's not my problem, that's somebody else's problem, I don't care about those people. Because we all are, it's all a whole. It will affect everybody, regardless of that situation. I hate to say, but we are very selfish in this country. And it's money driven. A lot of things are money driven. And that's the problem, that There's no such thing as upper, middle, and low. It's no such thing as you either got money, you can take care of yourself, you can get the treatment, or you just can't. We don't care anymore. And that's the problem that I don't like. And I see, and I think that with us going out bird dogging, our voices being heard, like Mia say, put more people who look like us, who has those disabilities in those places. We have power. We just have to use it and become more people in that power to make those policy changes. Staying silent. Just stop saying, well, I don't know what to do. There are so many things. If it's just writing a letter to the paper, if it's just going out talking to people, you have to be vigilant, because if you're not, it is going to affect you and people, your grandkids, your friends. So you just got to look at it that way.
Exactly, Erica. This affects not just a small handful of people. This is people's family, friends, neighbors. As we were talking about before, these policymakers are often the people who are in positions of power, positions of privilege, and we need to put people who are affected on the center stage. We need to empower them to use their voices, to share their stories, and make sure that the policymakers know that this is not just a small group of people. This is millions and millions of people who are being affected currently by this pandemic. I'm going to move on here to the next question, and I'll post it in the chat again. Richard L. from the UK, a keen observer of US politics, asks, with Trump loyalists winning some primaries, what will it take to have the Democrats still win the midterms? History is not on our side, nor are the press. Do any of the panelists have comments on this question and assertion? Who wants to start?
I mean, look, we don't have the luxury of, let the Biden administration, the Democratic Party, worry about winning the midterms. We have work to do, right? We have very specific work to do in our communities, at our state level, at our local level, at the federal level. All of us on this call have very little influence on what's going to happen in the midterms. We can get out and vote. We can do all that work too. But what we can do in the short term is that we have, 6 months, 4 months, 5 months until the midterms. We can gain a lot and win a lot between now and then. And that's what I think we should all be focused on. We are leaving too many people behind. We're leaving too many people in peril. We are destroying our healthcare system, even as weak and fragile as it started out to be. We need to stop the gaslighting and hold everybody accountable, Democrats and Republicans, and come what may in November. We're still going to have to fight in November no matter what. It's not like we've been able to accomplish so much of the Biden administration. Remember, we got a lot out of the Congress during the Trump administration in terms of the initial pandemic bill. So we're just gonna have to fight no matter who is in charge in the House or the Senate. But let's think about the short term and getting some stuff done in terms of Congress, our city governments, our state governments, because we can do stuff in the next few weeks, next few months, and have a summer filled with accomplishments, and come back in the fall and really be ready to go.
I definitely agree with Greg in terms of let the Democrats worry about sort of what's going to happen in the midterms. They've sort of gotten themselves into this situation. And what's incumbent on us as individuals is thinking about how can we build up our sort of the people that we want to be making decisions. How do we make sure that we take care of our communities? And that can be things like running for school, school board. That can be running for the county board. It can mean, running for mayor. I think so many people are so focused on national issues or national politics that they totally forget that there's a whole world in your community and in your state that unfortunately, the other side has been building on for years. We're way behind in terms of making sure that people who will make decisions that represent the people within the district, who don't have ulterior motives with different corporations or big businesses, etc. So I think it's really important that we stop looking at the big shiny thing and start looking more local, because we can build better communities. We can build power within our spheres, and we have much more control over that than we do the big shiny sort of policy legislative folks, or Congress critters, I like to call. So, I think that it's just really important that we think about what can we do in our communities that are going to better them, and let the Democratic Party figure out what they're going to do in terms of if they earn our vote.
I know we're running out of time. I just want to add to that. I agree. It does start with organizing, grassroots. That's very important. If you look at everything in the past, from the AIDS movement to Black Lives Matter to just civil rights, everything started with the people going out there, making that change, regardless of how scary it was. Sometimes you have to put yourself on the line, but I think about that's where the power is with the people. And I think we have forgotten that. We got to get back to that. Remember, we are the voice. We can make that change. If we don't get out there and don't say anything, then you're right, nothing will happen.
Thanks for your responses. That's right. It's always people over profit. We've got to remember that, and we've got to remind our policymakers of that. Okay, we have two last questions here. We'll try to get them both in the next 5 minutes if possible. Question is, ACT UP expanded on the definition of AIDS in a way that immediately extended benefits to hundreds of thousands of more people. What do we need to do to get long-term disability benefits to people living with long COVID?
Oof, that's a complicated question. Long-term benefits, we're looking at things like SSI, SSDI, Medicaid, Medicare. We need a better leader at Social Security. The issue of getting long-term supports, whether you're looking at SSI, SSDI, or even looking at home and community-based services, all of that is a disability issue. And this has been an issue for a while. The fact that there are more individuals who are going to need these services does put a strain on it. But this has been a long-term issue. And so what do we need to do in order to address it is to understand the mechanisms that help push legislation to better these programs. And also continuing to sort of drumbeat on the issues and trying to get folks to pay attention to the problems. We know from a GAO report like that was done like 10 years ago or something like that, that a huge percentage of individuals are either die or go bankrupt in the process of trying to get SSI and SSDI because the process is so arduous. We know that there's a backup of cases, at least 1 million cases that are backed up because the offices were closed. So what do we need to do? We need Congress to actually do something about these programs that have seen very little change since they were created. And that's going to take a lot of calls and a lot of pressure on your representatives to get them to realize that these are these are significant issues. In terms of like specifically talking about long COVID, that's something that unfortunately, because long COVID is so new, it's hard to have a definitive definition right now. NIH is doing some research to try and come up with a inclusive definition of what long COVID actually means, because long COVID is sort of a huge sort of umbrella term for a lot of different symptoms. And some of those symptoms are extremely concerning and life-threatening and debilitating. And some of them are, you know, not as debilitating. And so to try and figure out where's that line between, you know, individual is 100% disabled and needs SSI and SSDI and Medicaid and Medicare, and where does it end in terms of like an individual may get better, et cetera. And unfortunately, because it's such a new condition, it's just really hard for the administration to make clear sort of decisions based solely on the sort of umbrella of conditions around long COVID. So I know that's a long explanation of what's going on, but unfortunately, until NIH comes out with sort of some of their definitive definitions of long COVID, which they say they won't do until at least next year, we're going to continue to see a lot of individuals who are told no, they can't get SSI and SSDI based on long COVID alone.
All right, we'll move on to the last question here. During the beginning of the pandemic, we collectively shut down an economy when we stayed at home. We had power, we saw it. Now we're at the stage where we are told that we are powerless and told to give up on stopping SARS-2. But we can still stop SARS-2. How do we get back to being empowered? It's kind of a loaded question here, but whoever wants to start, you can go ahead.
So again, we were told that the Affordable Care Act was going to get down in flames. The Democrats in Congress said it, the big DC lobbyist organization said it, and people with disabilities, queer people, people of color, people of faith, small groups took over the Capitol. We got arrested in the Senate gallery in 2017. A small group of us fought back. So we were being gaslighted and told everything's normal and we should stop worrying. But you know, there were 105 people on this Right to Health Action webinar, right? That's more than enough to raise a lot of hell, right? It's more than enough to raise a lot of hell. And if there are more of us who are not on tonight, we have more than we need to shut down Congress, to chain ourselves to the White House fence. We can do a lot of making good trouble, right? Making good trouble, just us, right? So to get back energized and empowered, we already have the power. And they told us we couldn't do it with the ACA, and we won. We can do it here. We just have to sort of say, like, let's pick a date. Let's show up at the White House gates. Let's pick a date. Let's show up in the Senate Hart office building. Let's pick a date. Let's head to the Rayburn House building. Let's pick a date and make some plans. Don't worry about being empowered. We'll just bring everybody along, and there'll be more than enough of us to make a ruckus.